Hi, everybody. This is Dr. Kat Gallus, and I am on live for Instagram and ready to kick off an exciting conversation with my friend who is Dr. Jennifer Greer in Ohio. So she is going to be starting in just a minute, and we're going to talk about all things plastic surgery, and we're planning to do this every couple weeks. We're both moms of three, and as soon as she hops on, I'm going to introduce her, and we can talk about what's new in plastic surgery. I think even this evening, we're going to talk a little bit about COVID and how that's been impacting things, and then the vaccine. I am officially vaccinated. It's a little blurry, but I got my second vaccine shot today, and so far I feel pretty good. So good stuff. Let's see, and then Dr. Greer should be joining in just a second. I will there she is. We'll see how her evening's going and go from there. Go live. She's 3 hours ahead. There you are. Hey.
I was getting my recording
going.
going.
Are you going to be in mute? So, good to see you.
I know. Good to see you too. You look all awake and alert, and I'm like post bedtime with the kids frazzled.
Yeah, that'll be me in 3 hours. I fell asleep at 9 last night. I was wiped.
I think that's very reasonable. Yeah. How old are you? You're a little bit older than mine, I think, right?
Yeah. So I have a 9-year-old, a 12-year-old. I don't know. I have to think about it. And a 14-year-old. What about you?
Yeah, mine are almost 7, almost 5, and almost 2.
Yep. So same spread, but
a little bit
notched down a little bit.
A little bit earlier on.
Yeah. And then I have all girls. Do you have?
I have boy and 2 girls.
Oh, okay. All right.
So boy, girl, girl.
Boy, girl, girl. Okay. Was it different to have the girls afterwards in terms of like destruction and wreckage, or was he pretty chill?
Well, so you would think he actually is very like unaware of where his body is in space and will be talking to me and just standing on my foot. But our middle daughter is equally destructive in terms of like wreckage and just intense craziness. We were at Chick-fil-A one time, and these 2 little girls who clearly didn't have a brother watched her tear around, like, and their eyes were like saucers.
That's funny. Yeah, mine were more Princess Dressy, but
yeah, mine do that too. And then they throw on like the Batman cape, and it's all good.
That's awesome.
Yeah.
So I was mentioning that we're going to start talking every couple weeks about things that are plastic surgery. Yeah. We were talking earlier this week about what we should name this, and we've been.
We didn't come up with anything really clever. Let me think. I came up with plastics and play dates, but I don't know.
Yeah.
Carpools
and Cannulas.
Ooh,
somebody just asked a question about having 5 kids and having extra skin. Yeah, that's definitely a tummy tuck candidate, which I do a lot of, and I know you do too.
I just saw someone today with post 2 kids, and I'm like, I really need to get this done on myself first.
Right. I know, but so what's the big hang up with having a tummy tuck is what?
It's always the downtime. Always the downtime. Although I've been moving to a lot more drainless and doing nerve blocks. Are you doing the same kind of thing?
I have not been doing that, but that is would be you think the drainless gets people moving around faster, or?
I feel like it does, just because those drains are so annoying and it's hard to shower with them, and they tug. Betsy Hall Finley and I think Melinda Hawes, 2 other doctors that Dr. Gallus and I know. I started using the Stratafix quilting suture, which really closed off the space. And anybody BMI under 30, I've been going drainless, and they are like up moving. And then I do the tap blocks.
Oh, that's great.
Yeah, those help tremendously.
So Ruby Belamonte is asking if cool sculpting will not work. It does not tighten skin. It's equivalent for about a stick of butter each time in terms of melting fat. That's what I tell my patients.
Although I believe they do have FDA approval for mild skin tightening under the chin. But if you're to the point where you need a neck lift, it's not going to do the job.
Right. So with regards to tummy, you're probably going to need to have skin. There's almost no way to get it around skin excision. So
Yeah.
actually, one of the ideas we had for this in my office, they were trying to come up with some ideas was for naming this talk was incision decisions. So
Ooh, that's
it
good.
is true. There's always a trade-off for an incision. And so we talk about that. Like people want a certain outcome, but then are like, are there going to be incisions? And generally, yes. When
Yeah.
you do a tummy tuck, the trade-off is an incision. When you do a breast lift, the trade-off is an incision. It's our job to make it as pleasing as possible and, the nicest scar possible. But yeah.
And we have a
definitely.
lot of tricks up our sleeves too, because we're really good at placing them in places. Like I've seen some tummy tuck scars, and I bet you have too, that are just too high.
Mm-hmm.
And, then you can't wear a two-piece bathing suit. I did a revision on somebody just a couple months ago who had that issue, had a tummy tuck with someone else. So we know where to hide them. We know how to
Mm-hmm.
manage them post-op. We do the scar gel with silicone, and then we've got access to lasers if we need to flatten them
Yep.
out and lighten them. So it can make a huge difference who manages the scar.
Yep. And I practice very similarly. Do scar gel and lasers post-op, and it works really well to kind of get your collagen to line up like it's supposed to on the thing. And then I know my somebody's asking to give a thumbs up for names you like, but yeah, so we'll talk about that again in a minute, I guess. I spent way too much time trying to come up with a name for this little get together.
Oh,
But
no.
I'm sure
I
we'll
actually
figure
have
it
my mom
out.
brainstorming. She's like coming up a list of everything she can think of with kids and then everything she can think of with plastic surgeons. Oh, she did come up with makeover mamas, which I thought was cool, but it sounded kind of like it could be queer eye for the straight guy, and we're doing like lifestyle makeovers.
Right.
Instead
Yeah.
of mommy makeovers, but
Yeah. And to Ruby Belamonte, yeah, no problem on your answer. It takes on average 18 months of people thinking about plastic surgery before they even go in for a consultation for major surgery. I feel like people will do Botox on the fly, but really do a lot of research and consideration before you even kind of get in the door.
yeah.
Aesthetic Aaron's voting for incision decision.
Nice. The alliteration's nice.
Yeah. Have you gotten your vaccine yet?
I have Moderna first stage, and second one is next Wednesday. You had your second one today, right?
Today. Mm-hmm.
How you feeling?
And I got Pfizer. Fine. I was super tired before I went to get my vaccine. So, and then I had a Diet Coke, and now I'm good. So maybe that's the answer. Maybe you should take a Diet Coke with your vaccine, and then it'll be all good. So yeah. Interestingly, I don't know that there's been any issues with the Pfizer vaccine making news articles or any headlines rather. But Moderna, I presume,
Yes.
I presume
I saw
you knew about that.
That there have been a couple cases of swelling, and of course I have filler on board, like my face is
Right.
never without. So I had lip filler before Moderna, and I wondered if I was going to puff up, but nothing.
Yeah, so it sounds like I think they had 3 cases reported, and both as members of our national societies, we got, kind of updates and emails regarding all of that, and they were, hi, Dr. Smita. They basically said that there were just 3 cases of people having some prolonged swelling after having the Moderna vaccine, the first dose with filler. And when we all saw that, we were like, oh no.
I'm picturing
in
like
our
a
world
society meeting and we're all puffed up, but
right, it's going to be some big exposure of who has filler in their face. But I don't think it hasn't really been more of a concern. And I was a little upset because they gave us details about somebody had just had lip filler 2 days prior, and then the other people had filler 6 months earlier. But I don't think they didn't say what type of filler, we don't have the details on that. We're not the FDA. We're not privy to that information. So
I would say everybody resolved pretty quickly with just oral steroids and oral antihistamines. Like nobody had to have the filler dissolved, and nobody had to have steroid injections or anything crazy. So it was
right.
very self-limited and definitely worth being protected against COVID.
Right. Yes, it's definitely worth it in the effort not to get COVID. And then in San Diego, they actually pulled a lot of Moderna vaccines because they were concerned about anaphylaxis. But again, I feel like they're doing a really good job of monitoring everything and making sure that people are safely vaccinated. And so the women in my office got vaccinated with the Moderna vaccine. And aside from whining, and I'm calling you out, Erin, about this, whining about their arm hurting, which no, I know that was real. They were fine, and they're due to get their second dose shortly too. So
yeah, we're in phase 1A, so hospital workers are still getting it, but nobody's really had anything worse than some aches and maybe some chills.
Yeah, I'm hoping I don't get aches or chills, or I get a headache usually anyway. So, so, and then is your office they have to wait to get the vaccine, or?
Yeah, so doctors' offices in my area can do it, but the way they phrased it, it was either offices who see COVID patients regularly or primary care, and we're not really in that. I've had 2 staff already have COVID recently, so they're not too worried. And then another one of my staff is actually a part-time dental hygienist, so she was able to get it. So almost all the full-time people are protected.
Oh, that's good. That's good. Yeah. So, okay, well, I think we covered COVID pretty good. Let's talk about what you want to talk about next time. What do you think is good?
Because we have very similar practices, I think, right? A lot of aesthetics, a lot of body sculpting, breast implants, breast surgery.
Oh, so, my sister says we're coordinated in our colors. We did not,
No, we didn't plan this.
On Wednesdays, we wear burgundy.
Oh, seriously? Oh, yeah, us.
No.
I have I call it a capsule wardrobe, but it's really called I only buy the same 3 colors. So it's either blue, pink, black, well, I guess white and gray, but those are all neutrals. So.
Oh, that's smart.
And it all
stays in. Keeps it simple, and then you don't have to worry about coordinating when you have to get up and get ready to go to work, right?
I can actually grab stuff in the dark, and it usually matches okay.
That's pretty good. I still remember back when I was in the Navy, the interns took a picture of somebody who got dressed in the dark in their uniform and then showed up for work in their uniform and had red socks on with their khaki pants because he pulled red socks. Yeah, that's considered a uniform violation, but what are you going to do? You can go downstairs actually and buy uniform socks in the hospital, so solve that problem. Yeah.
That is like a whole different side of life that I've not experienced. Thank you for serving. And you've been deployed. You've been to Afghanistan, right?
Yes, I have. Yep.
I see those pictures of you on Facebook in your uniform, looking all serious.
Yes. Yeah. Trying to keep up my serious face. I sort of added a little pizzazz to Afghanistan, I guess, when I was there.
Afghanistan could use more pizzazz.
Yeah, it definitely could. I feel like I was telling somebody the other day, I can't remember, it was a patient, because I like to talk if I'm doing a procedure under local. It's nice to, keep the conversation going about how bad it smelled. Actually, I think it was my recent ER patient, how bad it smelled in Afghanistan, and that, because he was asking me about my deployment and asked me what people sent me, or if they sent mail. And I was like, yeah, they sent me all kinds of scented stuff because it smelled so bad there. Where I was just a little outpost. So it's not actually there's nothing there. There's no sewer system. It's just there's a pile of rocks and go set up an encampment. And so they burn all the trash. Oh. And so it smells nasty when they burn the trash. So I was fully stocked with Bath and Body Works and anything Uber Body Shop, anything Uber scented. But after a while, the other guys, the surgeons in my group that I shared space with were like, you smell like a cupcake at this point. And you're like,
are you not supposed to layer weird scents there?
They're like, we appreciate that it smells nice, but someone's gonna just kidnap you at some point and think you're a dessert. And I was like, I don't know, I just can't take the smell of burning plastic, and it's gross. So don't recommend burning your trash. Okay. Yeah, so similar practices. I feel like we could have a couple of different discussions and we can see what people want to hear about, but a lot of, we could talk about breast implants, maybe different types of implants.
Those are always good. And I actually had a patient ask me today, could I get sick from having these? I'm like, breast implant illness is a good talk. Let's discuss that.
Yeah.
So that's always a good topic to cover. I know there's a lot of interest in safety, especially of breast implants.
Yeah. So let's plan on maybe hashing that out at our next Wednesday chat, whatever we're going to call that. I think
yeah, you guys submit names. Like, I'm going to post this on my Instagram. I'm going to ask for submissions. We'll probably get something really great.
Okay. Yeah, we'll put it out to the public. I think that's pretty good. Where are your kids at in terms of, are they all in bed right now or?
Okay, so full disclosure, they are all in my room, in my bed.
Oh, so
right
we
now.
have even that similar.
Yeah. Oh, yeah. My husband is over yonder watching Cobra Kai and kind of half listening to this. But the kids have all decided to sleep in our room. The baby's crib is still in our room. And then the 5-year-old, we're like, yeah, we're going to sleep in there too. So he and I trade off nights, and he'll sleep in the luxurious setting of our daughter's bedroom tonight, and I'll sleep piled in the kids, and then tomorrow we'll switch. It'll be great.
So even the 7-year-old sleeps with you.
Yeah, he never was a snuggler, and like really since the pandemic hit, I think with the schedule change the last few months, he doesn't even go to bed in his room anymore. Like they both just go to bed.
Yeah, there's no pretense. Yeah.
I looked at that 12-foot wide family bed, and I thought that would fit. That would fit in our room.
I don't think our my husband would go for that, but we have a California king, which my sister says is unnecessary. King is good enough. But you can see right behind me, I'm in my master bedroom. That couch actually pulls out to a queen sleeper. And so my 9-year-old still sleeps with me most of the time. Everybody has their own room. But, and for the longest time, the oldest one slept in the couch, and then sometimes they would do sleepovers in our room, and it just, And the dog, I feel like Bailey entered, the dog sometimes comes in too, so.
Oh, my dog's like literally, we have the same life. He's right there.
Right?
I had this great idea to have my contractor who did our renovation. We have like dormered ceilings. So there's a knee wall and a storage area behind the wall. And I'm like, we could put a trundle bed on wheels and it could pull right out of the wall. and I could just shove it back in during the day. It'd be amazing. Kids could sleep like that.
Yep. I know we have so many other rooms in our house, but yeah, everyone gravitates to where you are, which I guess is nice, right?
It is good. I mean, at some point I assume they'll all scatter and then I'll miss them terribly. So
right.
Kid pile for now.
All right. Well, that's awesome. Well, so do they go to sleep by themselves? Because I also have a little bit of a challenge there.
Yeah, we have some fights some nights. We do like bedtime routine. One of us will put the baby down because she's still drinking a bottle. And then the big kids we read, and then they mostly will go lay in our bed. And we have found like audiobooks are really, really helpful.
Oh, I have a friend that did that.
Yeah, one of them will come down and be like, I had a bad dream. Well, you weren't asleep yet. Well, I can't sleep. So then they sit up with us for a while.
Yeah, I had a bad dream. You actually never went to sleep.
Yeah, it's weird. Your eyes were
that doesn't count.
Yeah.
Yeah, I was telling my sister I've been somehow managed to, now instead of reading, with my 9-year-old, I have to do a story where I am the voice for one of her stuffed animals. And so it's much more challenging than.
That is a high level of creativity to generate at that time of day.
Oh, gosh. And she'll be like, one more squeaker story. And I'm like, oh, I got to do the voice. I got to come up with a plot line.
Yeah. That's tough. That's usually when I'm tired like that. I'm like, do you guys want to watch how to make a cake on videos? Facebook. Last night I'm like, you want to learn how to make ice cream cake? Let's do that.
Yeah. Can we? Yeah. No, I've tried to pass that off. She's like, no. This poor stuffed animal's had all kinds of adventures because I get desperate. Had box jump fails. I don't know. Yeah. It's just like reaching. So, yeah. So, nighttime is always a challenge, and so I really appreciate you doing your East Coast time.
Hey, I told you I'd stay up at least till 9 p.m. That's all.
and you're keeping to it. So, all right, cool. Well, I think we will set up a time.
In a couple weeks.
Oh, Erin's trying to become a adopted kid from my mom, who stopped by my office yesterday and then harassed Erin because she wasn't dressed like me and Malia. So, and not nicely. She was like, and what's Erin's problem? Exactly like that.
Ouch.
I was like, no, she's treating you like me. I'm so sorry.
That's a sign of love, right?
It is. In my mom's case, it totally is. Who's not on Instagram, so this will never hopefully get back to her. But Yeah. So I think tomorrow we will talk about, tomorrow, oh my goodness, 2 weeks from now, let's talk about breast implant illness and breast implants.
Awesome. We will do it. And maybe we could switch off probably who starts the
Yeah.
live too, so our
Yes.
followers see it.
I will join you. I think that'll be perfect.
Awesome.
Thanks,
I'll still record the screen. Cool. So good to see you, Kat.
Yeah, it's good to see you. Have a good evening. Bye, everybody.
Talk to you soon.
Hi, everybody.